One of the things we do here in the clinic when I'm doing acupuncture is I always feel somebody's pulse. And they look at me and go, "Oh, what can you tell from my pulse?" And they're interested and they go, "How many beats per minute?" And I go, "I'm not looking at that." And they look at me and go, "What?" So in Chinese medicine, we use pulse as a form of diagnosis, not Western medicine diagnosis, but Chinese medicine pattern diagnosis. And we're looking at checking out your vitality, your spirit, your qi, your shen, and your root, and to check that there is no imbalance through your pulse. The pulse should be smooth, relaxed, even, long, harmoniously, almost show slightly gentle, and it should be present at all three positions at all depths. Now you're looking at me and going, 3 positions? Really? And of course it should be moderately forced, regular rhythm, about 4 beats per minute at 60 to 90 beats. So we would go 3 fingers here, here, and here. So we have 3 beats. Now, some people's are more around the back, some are more around the front, some are more on the top. But essentially, we are doing 3 points. And then we want to check 3 depths to check that they are all. And that's the other thing. We also take the pulse on both sides, left and right. So your left wrist links to your heart meridian, your small intestine, your liver meridian, your gallbladder, your kidney meridian, and your bladder meridian. Whereas your right pulse links to your large intestine, your lung meridian, your stomach meridian, your spleen meridian, your Sanji or triple burner, and your pericardium meridian. And we also then look at its different types. Now, we know there are factors that affect the pulse. Seasons. It's really interesting, but a season can affect the pulse. So we'll often find that it's flooding sometimes in the heart position, and that autumn or fall will cause more floating in the lung position. Winter tends to be deeper in the kidney position, and spring tends to be more wiry in the liver position. So we know that the season can affect the pulse. Gender can affect the pulse because we tend to find that for women it's a little bit more rapid, and when it's slippery we tend to see in women that they're either menopausal, pregnant or menstruating. That's a good indication. We also know that that can be slightly rolling. Body types, as you can imagine, taller people tend to have longer pulses, shorter people tend to have shorter pulses. Thinner people tend to have more shallow or superficial, and more larger ladies or men tend to have a deeper pulse. And we often find that if you are in a more physically active role in your job, you tend to find that you have a stronger pulse, the same with athletic. And we tend to find people with more mental work, who are more fatigued and run down, tend to have a weaker pulse. So the pulse quality is telling us an awful lot. This is how the TCM diagnosis is started. This has been Thoughts with Points. Check out your pulse, guys. Take care.